Good afternoon. I want to welcome you to our Tuesday press briefing with updates on COVID-19. As of this morning, we've lost almost 130 citizens in our community. Please join me in a moment of silence for the lives we've lost and for the families they leave behind. Thank you. Now we will hear updates from our community leaders. First, we'll hear from City of Albany Mayor Bo Durrell. Mr. Mayor.
Thank you, Chief. Good afternoon. I want to speak today about reports from the staff at Phoebe Putney Hospital and test results and the challenges confronting our rural communities. While the number of COVID patients at Phoebe Putney is down considerably, we continue to see admissions about on par with discharges. There were 6 COVID admissions and 5 discharges on Friday, 4 COVID admissions and 5 discharges on Saturday, and 3 COVID admissions with no discharges on Sunday. We are, obviously, encouraged by the fact that less than 10 COVID patients have been admitted each day over the course of the last 2 weeks, with the exception of 1 day. The fact that we have continued admissions confirms the virus continues to spread and more people are contracting the virus every day. Remember, we know that less than 20% of those individuals who have COVID-19 require hospitalization. Thus, we can reasonably surmise that the number of newly infected is 5 times the number of people who are being admitted. The more than 80% of the individuals with the virus who have little or no symptoms will, in all probability, be contagious for a period of up to 14 days, during which they can infect that group which is most vulnerable. This is one of the many reasons we need everyone to be tested, as obviously no one would knowingly place others, particularly the elderly and infirm, at risk. Those who test positive, who have mild or no symptoms, will receive instructions on isolation once they are notified of the test results. The city manager has been compiling the data from the various testing sites, which include Phoebe Putney Memorial Hospital, the Department of Public Health, the National Guard, and private practices. Ms. Subadan notified the task force this morning 4,347 specimens were collected between April 26th and May 8th. This is an average of 334 a day. We still need more people to be tested, as this figure, increased by the number of individuals who were tested prior to April 26th, being approximately 9,000, represents approximately 15% of the county's population. We know that approximately 2% of those who contract COVID-19 die as a result of the virus. We know that the mortality rate for those patients who are placed on a ventilator is, in the words of Dr. Kitchen, exceedingly high. Phoebe's CEO recently notified us that 32 patients have been extubated. This means they have been successfully removed from the ventilator and now are breathing on their own. Let us all remember the 37 patients who remain on ventilators. The numbers from other counties in southwest Georgia are alarming. As of today, there are 402 cases in Sumter County with 33 deaths, 353 cases in Mitchell County with 22 deaths, 341 cases in Lee County with 22 deaths, 227 cases in Early County with 27 deaths, 213 cases in Colquitt County with 10 deaths, 197 cases in Terrell County with 23 deaths. In Worth County, 184 cases, 13 deaths. Randolph County, 169 cases, 21 deaths. Turner County, 78 cases, 12 deaths. What is particularly alarming is in 5 or 6 of these counties, the number of deaths represents 10% of the positive cases. So that tells us that individuals in these rural counties are not being tested. What I want to say today, Dr. Ruiz will speak to it. Fortunately, the Department of Public Health has opened up testing sites in many of these rural counties. The state is also operating mobile testing units. What we need people to know is that individuals from outside Dougherty County can come and utilize the National Guard Testing Center. Dr. Ruiz will correct me if I'm wrong in saying this, but it's my understanding that the Department of Public Health is now, like the National Guard site, testing anyone who wishes to be tested without any criteria whatsoever. As a result, there is no reason that we cannot substantially increase the percentage of Dougherty County residents from, as I said, approximately 15% in the coming weeks. Now, a large percentage of the residents of our rural counties are among those who have the highest mortality rates, being those who are 65 and older with some underlying serious medical condition such as diabetes, hypertension, heart disease, obesity, and respiratory disease. Most of these counties do not have a hospital, and those that do are generally understaffed and do not have intensive care units, which are necessary to care for those in respiratory distress. We, again, encourage residents of Southwest Georgia to take advantage of the resource we have here in Albany, and I understand Dr. Ruiz can speak to it, but in some of these counties where there are no testing sites, please feel free to come to Albany, be tested, protect yourselves, protect others. Thank you for your continued attention, thank you for your diligence, and thank you for your cooperation and support. Thank you.
Thank you, Mr. Mayor. Now we'll hear from the Chairman of the Dougherty County Commission, Chairman Christopher Cohelas.
Thank you, Chief. Thank you, Mayor. As always, I want to begin by sharing my condolences with each of the families that have lost family members during this COVID-19 crisis. You continue to be in our prayers and our thoughts, and we will continue to open our hearts to you and do everything that we can under the current circumstances to provide comfort and support. I want to talk for a minute about some of the statistics that we are seeing and talk about some of the testing that we've had going on. And I want to explain the transition in the different types of tests that we have had here in Dougherty County. At the very beginning, what we had was testing that was available from Phoebe Putney Memorial Hospital. They set up the drive-through. They set up a call-in number, and people that called into the number, they went through a screening process. They determined whether or not they met the symptoms. They were then eligible to take the test. The Department of Public Health then had some testing that was available to people that met certain age requirements and other demographic requirements, and that was also required that they have certain symptoms. They also affirmatively tested first responders and healthcare workers. Now we are in a different place, and I think that's important because what we were primarily doing in this community several weeks ago, based upon the resources that we had, we were testing people predominantly that were just symptomatic. And what we know about this virus is that it infects far, far, far more people than ever will ever show a symptom, than ever will ever require being in a hospital or being on a ventilator. It is literally, so the more you test, the more you uncover the number of people that are infected in your community. Is that a good thing or is it a bad thing? It's a good thing because now you can actually truly address the problem. And one of the things, and I want to explain this, because the mayor has said this, and I fully agree with the mayor. We need everyone to get tested. And I want to explain the reason why, because we have a team of contact tracers. So I want everyone to imagine this. You're going about your day, you're going about your day, moving on along. and you're completely fine. You think everything is good, but you decide you go ahead and get tested. You feel completely fine. Then you find out that you do have the virus. It's not the end of the world. What's going to happen is they're going to get information from you. They're going to contact you. They're going to tell you that you have the virus. They're going to ask you who you've had contact with, so that they can then notify those people whom you've had contact with, so that they know to isolate and self-quarantine themselves, so that they can avoid, and you can avoid, the further spread of the virus. We have the resources here that we've requested the Department of Public Health to hire more people in order to do the contact tracing. We've also requested that we have faster testing. For a little while over the past week, we had slower test results, but that's catching up. And as I understand it, we're getting a new vendor to take care of that. But that is why it's particularly important. It's also important because initially the way we were looking at statistics was, oh my goodness, the number's going up, and all we were looking at were the symptomatic people. What's actually important to do is to find also the non-symptomatic people, so that we can put contact tracers to that job, so that they can help self-isolate the people that are walking out amongst us who have the virus. Now, I'll say this. You're not going to stop the spread of the virus on any one day. It's not going to just magically eliminate absent someone finding some sort of vaccine. And I haven't heard anything about that from any credible or reliable resource. So what we have to do is to continue to manage this. And the way we're managing it is by getting people to testing sites. And I agree completely with what the mayor was saying, and I want to expound on one thing. These surrounding counties also don't have the documented numbers of people that have been tested positive as Dougherty County, because those counties have not had access to the same levels of testing that we do. We want to help everybody. We are centrally located. We are the metropolitan hub for Southwest Georgia, and we need everyone in Southwest Georgia to come and get this testing, because it helps us express our needs. If you have that many deaths in Terrell, that many deaths in Sumter, that many deaths in Worth, Lee County, that tells you that you have far many more people that have the virus, that are going about their everyday lives continuing to infect other people. And so what we need to do is to really, and I want to say this, there are a lot of people that I've seen in this community that have taken a very progressive view about the virus. There are some other people that have taken a view that stigmatizes people that have the virus. And I want to say this, no one should be stigmatized. No one did anything wrong. This is no different than catching the cold, except for the fact that in some circumstances, the consequences are far greater. And it puts our elderly and our medically fragile people in extraordinary danger, and we don't want to do that. I want to turn our attention to one of the graphs that's on the television right now. Right now, we are doing testing at Phoebe Putney Memorial Hospital. They're doing testing of every single person that gets admitted to the hospital, irrespective of whether or not it is for a broken toe or for a heart condition or for COVID-19. They're testing people. Augusta University, in conjunction with the National Guard, is testing people. Anybody can go and get a test from this surrounding area at that site. Additionally, the Department of Public Health is doing that as well. So what we've been doing, and we're going to make these results available, are daily tracking results of the virus. And I think it's important to understand our concept of the curve flattening will change with the data that we receive, because before we were predominantly only testing people that were symptomatic. Now we're aggressively and affirmatively testing more and more people. But what we are seeing is pretty fascinating in this regard. Let's see if I can find it. We are seeing a greater degree or a greater percentage of negative tests. And that is showing us this. While we're still admitting some folks to the hospital, that's going to continue to happen. But what is encouraging is we're showing a trend that is clearly demonstrating that a higher number of people are testing negative than ever before. When we started out, some of the first test results that we received back at the very, very, very beginning, at one point was like 80 or 90% of all the people that were tested were positive. And we've continued on along, and I've said this, I'm going to say this again and again and again and again. This is not a sprint. It is a marathon. We've had to change the way that we culturally interact with each other, the way that we hug or don't hug, or we don't interact with each other. We've had to clean. We've had to learn new things. We had to talk about masks. We had to close church services and funeral services for a while. We've had to do a million different things. And so we have a different way of looking at the world now. We have different rules that are in place and different rules that are transitioning, and that's helped us lower the number. And you can see that in this one report that's on TV or on the screen at this point. And I want to go back right now, and I want to say thank you to the community. I want to say thank you to every person that is masked up, every person that is sheltered in place, every family that has taken extraordinary precautions, that carries hand sanitizer, that makes sure that only one person shops at the grocery store. I want to say thank you. Because as demonstrated by the pie chart that's on the television right now, we are showing 8% positive versus 92% negative results. That is remarkably astonishing in comparison to where we were when I was standing here and the mayor was standing here 4 or 5 weeks ago. It's astonishing. Does it mean that we should stop doing what we're doing? No. Does it mean that we're not going to transition? No. There's hope at the end of there's light at the end of the tunnel. It's just we have to take several steps before we get there. And I want to talk about some of the steps and some of the questions that I'm getting. And one of the things that I think is very important, and we've received so many questions about this, and it's such a fair question, about how to prevent the spread of COVID-19 at churches and places of worship. And right now, in our community, with nearly 130 people that have passed, with the amount of damage that this virus has wreaked upon our community, there could be no better time than to have a place of worship or to be able to commune and to share thoughts, spiritual feelings, getting a message from your pastor. I get all of that. And churches are making their own decisions. Some churches are opening, some churches are not. But some of the information that we're going to be putting out online is information about how churches and places of worship, when they make the decision, or if they make the decision to reopen and move away from online, how they do that. And these are some of the things I've been talking about. How do we begin to transition into a future? Because in reality, we can't all stay closed up in our homes forever. That's not sustainable. You can't ask people to never make a living again and for them to forfeit their ability to provide meals for their families. I mean, there are literally people in this community that are completely food insecure and that have been living on the razor's edge as a result of this virus and this pandemic. There are I'll say this, the cure cannot be worse than the virus itself. So we have to become more sophisticated in how we move about and how we continue to protect those that are medically fragile, how we continue to protect the elderly, how we continue to do the things that we need to do, also taking the necessary precautionary steps to make things as safe as possible in the community so that we can actually move back to some normalcy. And some of the information that is out there about churches and places of worship, it talks about things that many other businesses and other entities are also doing. It's got good information. It talks about deep cleaning the building, increase cleaning and disinfection after each service, offer multiple services to accommodate social distancing of at least 6 feet. Don't hand out bulletins or flyers. Provide hand sanitizer throughout the church. Elderly and medically fragile individuals should consider staying at home. And these are some of the messaging points that I want everyone to consider in all facets of life, not just with respect to church. But that's good information, and I've gotten a lot of questions. Well, what do churches, what can people do? Well, under the governor's order, 10 or more people can gather without social distancing. I would suggest to you that it's still a good idea to social distance, but the current regulation is that gatherings of 10 or more can gather without social distancing. Now, you make a decision as to who those 10 people are that you want to gather with, or where they've been, or who they've had contact with. That's up. People have to make decisions that are consistent with their own individual freedom and their best decision-making processes. But for churches, you can have a gathering of 10 people without social distancing. But if you want to have more than 10 people, everyone has to social distance. What does that mean? What does that look like? That means everybody's got to be at least 6 feet apart from each other. And I would still recommend that everyone wear masks, because if you're going to be bringing in 100, 200, 300 people into a building, that's a lot of breathing. It's a lot of touching. It's a lot of objects, flat surfaces, and things of that nature that can be infected, and the virus can be spread. So please consider some of these steps. Please take us up on this information. Again, we are very thankful for the resources that we have, both at the Department of Public Health, as well as at National Guard, right behind the Civic Center. And again, please take time out of your day to get tested so that our contact tracers can literally determine where this virus has been, where it's going, and how we can slow it. Thank you.
Mr. Chairman, thank you for your remarks today. We will now hear from our representative from Phoebe Putney Memorial Hospital. Dr. James Black is the chairman of the emergency department. Dr. Black?
Good afternoon. Listening to Mayor Doro and Chairman Cahilas, I'm often amazed at their depth of understanding of the disease process. And if I didn't know any better, I think Dr. Kitchens and I might be out of a job soon. But their involvement and others from them and others in this room has been instrumental, I believe, in gathering resources from a state and a federal level and helping us take care of our patients. So I do appreciate their level of understanding and involvement. Our current numbers show us to have throughout the hospital system a total of 71 patients that are currently admitted for COVID-19. A total of 301 have recovered, and our total number deceased through the hospital system, again, this is those that have gotten care through Phoebe Putney, equals 117. I know that our coroner, Mr. Fowler, will give numbers for Dougherty County, but just wanted to make sure you understand what numbers that we're reporting. As you can see on the graphs, especially the one that has the orange and the blue, since early April, or since mid-April, you can see a steady decline in the total number of patients that are inside the hospital. But as the mayor and chairman have also said, that number is not zero. We continue to see patients. Those are the number of the patients that are admitted. There are several more that we see and that are not ill enough at this time to be put in the hospital that we see and we discharge home from the emergency department. So although things are better, we are not done yet. So want to keep up those good practices that we've been employing for the last several weeks as we continue to try to slow the spread of this disease. Other than that, I want to thank everybody for continued cooperation, and we'll see you in a couple of days.
Dr. Black, thank you for your update today from Phoebe Putney Memorial Hospital. We will now hear from the Director of the Southwest Georgia District of the Department of Public Health, Dr. Charles Ruiz. Dr. Ruiz?
Thank you, Chief. Okay. I would like to also thank the media in Southwest Georgia, television, radio, newspaper. We've had a lot of great partnerships, and the media has helped us to get facts out to the community and get knowledge out to the community, and knowledge is power. And we appreciate everyone who has made a positive contribution in this response to the COVID-19 pandemic. Mr. Cohilas and the mayor have both offered some great wisdom today, particularly when they're talking about the testing for COVID-19. I'd like to echo what they said and just kind of summarize and say that one of the things that testing does is it gives us an ability to kind of measure the relative amount of health in the population. It also gives us an idea or tells us a lot about the health of one individual. And as Mr. Cohilas said, we can use that information then to try to find out who the sick individual has been in close contact with, so that we can identify other individuals in the community who are at risk for developing the COVID-19 symptoms. And we would like to do this before they actually develop the symptoms. So let me define a couple of terms that you'll hear. Sometimes we'll talk about contact investigation. And so what we're talking about there is when someone is diagnosed with COVID-19, we're going to have a public health a professional or volunteer to get in touch with that individual who has the virus and try to find out exactly who they have been in close contact with, going backwards in time as much as a week or two, depending on the situation. And then once we find out who is at risk, we're going to reach out to those people and explain to them the significance of their encounter and let them know that they may be in danger of developing the symptoms, and we're going to talk to them about the importance of being quarantined, preferably at home, and that is for a period of 14 days following their most recent contact with an infected individual. So that's kind of how the contact tracing works, and we have been increasing our numbers of staff who can help us with this, and we're going to continue to increase that number until we are sure that we've got enough people on board so that we are watching over the health of the community to the best of our ability. So with talking about the testing, let me maybe draw your attention to the slide that hopefully you can see. This kind of summarizes over the next 5 or 6 days the opportunities for being tested through public health in Southwest Georgia. So it's easy to make an appointment. The telephone number is there, 229-352-6567. It's a toll-free number. You can call from anywhere in the state, and you can set up an appointment. It is possible to show up without an appointment, but we strongly prefer that you make an appointment. It will help to reduce your waiting time, and it will help us to ensure that we have the necessary staff and materials so that we can serve you with efficiency. So over the next few days, we have actually 7 different locations to choose from. We have collection sites going on in Decatur County. Actually, we had one yesterday. We'll have another one this coming Thursday in Bainbridge. In Dougherty County at the Health Department, Monday through Friday of this week. We normally have a collection site going on Saturday morning at the Dougherty County Health Department on South Slappy. But we're doing something a little bit different this week. We're trying to make testing more accessible, particularly to those who don't have transportation. So this Saturday, we have made an arrangement with the kind folks at the New Jerusalem Pentecostal Faith Ministries on South Madison, 2117 South Madison Street. Saturday morning, we will be performing collections there. We will be set up for people to walk through and get tested, and we will also be set up for people to drive through. Again, we prefer appointments to be made, but we will not turn people away if they come without an appointment. Then in Grady County, we have a collection going on today, and then another one this Friday. Mitchell County, Monday through Thursday of this week, and then again on this Sunday in Mitchell County. Terrell County tomorrow and Saturday. And I want to mention that we were very fortunate this past week to be able to test people or to collect specimens in Dawson at Terrell Academy. But this week we will be relocating, and that will take place at the health department in Dawson. And then in Thomas County, Monday through Saturday. So those are the locations, and it's a bit inconvenient, I'm sure, but we do change them around from week to week. Part of our strategy is to try to go where we feel like the need is the greatest. So each week we will update our locations and our times if they change also. As it was stated earlier, there are no criteria to be met of people who have symptoms, and people who do not have any symptoms can come and get tested through public health. And if you get tested, if you have a positive result, you can expect a phone call. If you have a negative result, you can expect a phone call. And I'd like to apologize in advance because in some cases you may get more than one phone call. In some situations, one call will be made and we'll gather all the information that we feel like we need. But in other situations, you may get a call from one person that tells you the result of your test, and then you may get a call from another person who will further investigate. We're sorry for the inconvenience, but we ask that if you've been tested, to please be ready and prepared to answer your phone, even if you do not recognize the number. We're simply calling to help. And when we're calling to ask questions, we're not trying to pry into people's private lives because of curiosity. We're trying to find out who you might have been close to so that we can help those people and to try to improve the health of the community. I'd also like to say that if you get a phone call telling you that you tested positive, it would really be a great help if you would go ahead at that point and try to reach out to those people that you know you have been in close contact with to let them know that they may be in danger of developing the infection themselves. We would want those people, as I say, to quarantine at least 14 days after their last contact with you. So that would just be another added layer of security if you would be willing to do that for us. And then, of course, we're going to follow up and reach out to those same people. But the quicker they get that information, the quicker they can take action. And then the last thing I want to mention is this afternoon, Governor Kemp is scheduled to hold another press conference at the state capitol at 4 o'clock this afternoon. So if you're able to tune in, I'm sure he will share important information for us all to hear. We thank you for your cooperation. Remember to practice social distancing, wear a mask when you're out in public, wash your hands, and by all means, if you're sick, do not go to work. Thank you.
Thank you, Dr. Ruiz. We will now hear updates from Dougherty County Coroner, Mr. Michael Fowler.
Good afternoon. Again, I want to give God the glory just for being here, the ones that still here. And my prayers go out to the ones that have lost someone, also the ones that's in the hospital. Not only those, just the ones that are out of jobs, the ones that did not get to walk across the graduation stage. I think many have lost during this season. At this time, I'm gonna deal with the death, and I want to piggyback on a couple of things. Right now in Dougherty County, we have 130 death, positive death residents here in Dougherty County as of today. Some of the numbers have changed. In 3/17/21, the numbers still 17 in the northwest side. 3/17/07 is 27. The number have changed now. On the east side, 3/17/05, still 28. On the south side, the number have gone up to 58 deaths on the south side. The COVID death, females, we got a total of 70, that's 54%. Males, we got a total of 60 at 46%. The Latino, we have 1, and we have 28 whites, and we have 101 blacks. That's 78%. We have the 1 Latino male. We have 19 white females. We have 9 white males. We have 51 black females. We have a total of 50 black males. The age have changed also, the age bracket. Now we have an age, 1 in the age of 20. We have 3 in the age of 30, 8 in the age of 40, 7 in the age of 50, 40 in the age of 60. We have 36 in the age of 70, 24 in the age of 80. We have 10 in the age of 90, and we have 1 in the age of over 100. The average age is still 71. The oldest person that have died, resident of Dougherty County, was 104. The youngest is 26. Location of death, 105 have died in one of the hospitals, not necessarily fever, but in a hospital. 19 died in the nursing home, and 6 died in the residence. Number of deaths by week, some that have changed. The first week you saw was a 10. The second week, March the 22nd, was 17. Third week, March 29th, was 28 deaths that week. The fourth week, April the 5th, we have a total of 26 died that particular week. The fifth week, April the 12th, 25 died that week. The sixth week, April the 19th, we had 7 to die that week. April the 26th, we had 13 to die. Last week, we wound up with 3 deaths. That was the 8th week. It was May the 3rd, we had 3 deaths. And that as of this week, we have just 1 death so far. So the death rate is declining. We thank God for that. Again, you got to mask up. I want to encourage you too, when we're talking about testing, each one I have mentioned about testing, just because you test negative, don't mean you can't get the virus. When you go into stores many times wearing your mask just on your mouth and your nose is still out, you can catch that virus. A lot of times people just wearing the mask on the mouth, but you still can catch that virus by your nose being out. So you got to have your nose and your mouth covered. Also, just because you tested negative, got your negative results back, maybe a week or so, find out that you were negative, don't mean that you are clear of the virus. You still can get the virus next week. Because you were tested negative, and you go out saying, well, I don't need to wear a mask, I was tested negative. You can go out and be around and exposed to someone else next week and have the virus and start picking up some symptoms. So I want to encourage you, just because you tested negative, still wear your mask, still practice social distance. They're going to be very important. I don't want you to get the mindset that because I'm tested negative, I can just go out and do as I please. No, you still got to be cautious yourself too. And you still can catch that virus. So I want you to say, be safe. We don't want the number to go up no higher. And I want to thank the ones that have been practicing social distancing, been wearing your mask. I want to keep giving God the glory, and we got to keep on praying. We got to keep praying because God going to have to give the doctor the wisdom and give us the vision how to move forward, eventually open back up to some form of normalcy. Again, thank you.
Thank you, Coroner Fowler. At this point, we will open up for any questions from the audience, media. Okay, if there are no questions. We will conclude today's press briefing. We'll be back again on Thursday at 1 p.m. And of course, we encourage you, if you have any questions about anything you've heard today, you may call the Emergency Operations Center. It is open 7 days a week. We are there to answer your call at 229-302-1900. That's 302-1900. Thank you, and remember, mask up Albany, mask up Dougherty County. Have a great day.